Homelessness has been the biggest struggle that our city has faced longer than I've been the mayor. And the reason I would say for that is that the city has stood alone largely in trying to address what is actually not a city-specific issue, but a statewide, a regional, even a national issue that takes the cooperation of different levels of government and the insistence that we work together on solutions that actually work, that address the root causes of an issue. Now, the criminal justice system as the solution for mental illness is never an equation that's going to balance out. And that's why cities, counties, and states are turning inward to each other to say, if the federal government's not going to help us fix this, how are we going to do this ourselves? In the last several years, the state of Utah, in partnership with the county and the city, have really revamped homeless services, going from the one downtown shelter to 3 specific shelters serving the specific demographic needs of women, couples, and single men. And as we've gone through this process, the piece of the population that the system has really never served well is those who are experiencing mental health needs, even severe mental illness with homelessness. And the only mechanism for serving those individuals has been the criminal justice system, which was never built to successfully serve or meet those health needs. Criminalizing mental health is not the route, but it's the only path that's been available since the early 80s, really. We've been exploring other parts of the country that have recognized the same deficiencies that our system have, but have knit together a much more humane and a better system that actually saves a lot of money overall, and most of all provides services that simply don't exist today. Miami is one of those places. And we sent some staff down several months ago from governor's office through the county justice system, jails, police department, and my office, and asked our staff to come back and let us know if this was a model worth investigating at a deeper level. A few weeks ago, representatives from state, county, city organizations, and the courts went down to Miami and took a couple of days to do a deep dive with those organizers. It's a fascinating, effective, and a really humane approach that we have all come back wanting to implement here in Utah. At a 30,000-foot view level, what they're doing there, instead of incarcerating and re-incarcerating and putting people back out on the streets who are actually facing mental health crisis issues, but are being criminally prosecuted for them and the actions that may surround those circumstances. In Miami, they're saying, look, here's the criminal justice path you can go on, but what we'd rather do and what we believe would be better for you is to go into housing. That housing is going to be case managed and supported. You're going to have access to the mental, behavioral health needs that you have today, and we're going to stay with you for at least a year of these services being provided. There are peers who've been through the program before and who are there as a support for these individuals. And in 22 years of existence, they've never had a person say, I'll take jail over this program. They've actually been able to close a jail about a decade into the program because they've reduced the number of bookings so dramatically. And that is something not only that we want to do, but we should be doing here in Utah. We all came back enthusiastic and ready to get to work on the next steps of figuring out what it's going to take, because it is going to take change and commitment at every level of the process. We will be mapping out our cooperative agreement, meaning how are we going to commit to work together going forward on this so that we can find success. Well, after that, we'll be doing our systems mapping, which will be assisted by an organization that specializes in coming in at this high level and helping us clearly identify where the gaps in the system are. Next steps then will be potentially legislative, financial, and interlocal agreements so that we can share the data, cooperate together to provide the best possible outcomes, and make sure that the housing stability, which is so key to the success of this, is integrated into this process. This integration is not something that any city could do on its own and would never have the funding to do on their own. The relationship part of this between the state, the county, the city, the service providers, Department of Health and Human Services is so critical. And it's not only exciting that we have found a model that we want to implement here in Utah and in Salt Lake City, but that we have the partners who are saying, yes, I'm going to stop putting my fists up and saying, why aren't you doing this? And I'm doing all of that. we are coming to the table together, identifying how much we need each other, and we're committed to working as partners to get this done.